Hello, listeners of the Everything Medicare Podcast. Christian Brindle here, and even though this episode that you're about to hear specifically discusses a particular insurance company in the Medicare health industry, it does not mean that the Everything Medicare Podcast, Christian Brindle, or Christian Brindle Insurance Services endorses them or recommends anybody enroll into any of their plans for any reason that is going to be talked about on this episode today. We do not endorse or recommend any particular insurance company over another. It all is dependent on a particular person's situation. Thanks for listening. I hope you enjoy. What's up, everybody? Thank you so much for tuning in. And this is another episode of the Everything Medicare Podcast. I'm your host, Christian Brindle, where every single week I bring you two podcasts where I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Hope you had a great weekend. Today is Monday, and I am just so thrilled and so happy to be able to talk with you. If you missed our podcast episode that we uploaded on Saturday, go and listen to it right now. It's I interviewed Cody Askins for that podcast episode. And if you don't know who Cody is a celebrity in the insurance industry. It was an honor to have him on. It was a privilege, and we had a fantastic conversation about Medicare and the Medicare industry. Cody is somebody who, trains insurance agents in all different industries all over the country. He's worked with multiple numbers of beneficiaries on different types of industries. Medicare particularly is a place that he worked with, and he has a lot of insight in it. It was a great conversation. Cody's not even 30. Cody's 29 years old. So he's accomplished so much in such a young age, and I thought that it was just a fantastic conversation. If you missed it, you want to go back and listen to it. It's worth the listen. I guarantee it. Thank you for tuning in, though. And if you don't know who I am, my name is Christian Brindle. I own a company called Christian Brindle Insurance Services. I live just outside of Salt Lake City, Utah. And I grew up around the insurance industry. My dad was a insurance agent for a long time, for about 30 years, working with people on Medicare. And he was one of the first people to really pioneer it in our area in Utah. And for those of you, if you haven't heard it, I did an episode maybe a couple months back where I interviewed my dad. And that was a really interesting conversation because he's someone that's an original pioneer in the industry. He's seen a lot. He knows a lot. We had a great conversation, and he was the first person that was my teacher and my mentor and got me into the business of insurance as a whole. So that was a really, really good conversation. Basically, folks, my objective with this podcast is to make Medicare easy. I want to give you empowerment. I want to empower you in a way that nobody else is really doing, to put the knowledge in your hands so you can make a better decision. I think there's too many people in the insurance industry and the Medicare industry as a whole that their objective is to keep the information from you so they have the power over you. And I think that's wrong. I disagree with it. And I'm going to flip this whole industry on its head with what we're doing here. Before I get started on this week's episode and kind of the topic we're talking about, which is a spicy one, I can't wait. I'm so excited. And I'm kind of treading on thin ice with it because insurance companies don't really like me talking about them, particularly in this type of setting. If you've noticed, if you've listened to me since the beginning, I usually don't mention insurance companies' names ever because I got to watch my own butt. My company and my organization is contracted with pretty much every large insurance company in the country, and so we have working relationships with these people because we're a brokerage is what we are. We offer their plans to different people, and we sort through the options and find people the best available fit. And so I have relationships with these companies. I don't want to rub them the wrong way. But at the same time, I want to produce information for you that is real, authentic, and information you need to hear, and people in the insurance industry don't always like that. But the main thing I try to do is I try to stay away from talking about particular insurance companies as a whole. I've done it one time in the past. It's been a very popular episode I did about CVS and Aetna and that whole thing. You guys loved that episode, so I'm doing another one similar to it. So I'm kind of taking a chance here, seeing how this goes. But anyway, I'm talking about United Healthcare today, folks. United Healthcare. Okay, so let's just talk about some facts about United Healthcare. The facts of United Healthcare is United Healthcare is an American for-profit managed healthcare company based in Minnesota. They are the largest healthcare company in the world by revenue, with a 2018 revenue of $226.2 billion with a B dollars, and they have 115 million customers. The company is number 6 currently on the Fortune 500 list as this is being recorded. There you go. I mean, United is a giant. United is humongous. They are the 600-pound gorilla in the insurance industry as a whole, and they do all different kinds of things. They are extremely prominent in the in the Medicare industry. They're extremely prominent in the group plan industry, as amongst other things, but those are the main 2 things. Today I'm just going to talk about Medicare. Why are they so big? How have they done it? What makes them different from a lot of these other companies? Now, like I said in the intro, the disclaimer, they're not always going to be a fit for everybody. Absolutely not. I'm just talking about why they're so big and why they've had so much success. In my opinion, from my observations, working with the company very closely for many years. Okay? I'm not going over their history really as that much. If you guys would like it, I will make a YouTube video about that one of these days. And speaking of YouTube, before I get going, this podcast will now be on YouTube. Every single episode will be on YouTube going forward. It's going to take some time for us to get all episodes on there because we're in the 70s as far as episodes now, but we've got the first 15 up on YouTube right now under our Christian Brindle channel. So if you'd like to listen to the podcast ever with no ads, that's where you do it. There's no ads on the YouTube podcast episodes. We have to do the ads on the podcast as a whole because that's sponsorship. That's how we make it worthwhile for us. It's how we keep the lights on. But yeah, just wanted to let you know. There's a new platform that you can listen to the podcast on, and that is YouTube. Give us about a week to have a single episode up, though, including this one. It might take some time. Anyway, back to the topic at hand. United Healthcare. So United Healthcare was started in 1977. Okay, they started out. They were founded by Richard T. Burke, and they started out as a parent company to another company, and they started out kind of small, and they really went through some growth, especially in the early 2000s. United Healthcare as a whole, folks, why are they so successful? What makes them so different? Well, let me give you my observation. Now, I'll say it one more time because some people listening to this will not get this, and it could get me in trouble. Don't want to get in trouble. There is no particular insurance company or plan that's a good fit for everybody, and there's no one-size-fits-all, and United is definitely not a one-size-fits-all company for everybody. I'm just talking about why they've been so successful. Period. Point blank. Okay? So, but what do they do? What do they do that makes them so highly successful? Well, this has been my observation of United, and like I said, I'm not going to go off on their history too much. That's not what I'm interested in talking about. This has been my observation. United Healthcare has had weaknesses over the years, just like every other company. From my observation, they have put a lot of focus on patching up areas that they haven't been very prominent in. And I'll give you some examples of that. In 2010 or 11, I can't remember, they founded Optum Care. If you're a United Healthcare customer, you probably recognize the name Optum Care. Optum handles a lot of different things for United, and people think a lot of times their insurance is being provided through Optum. It's not the case, okay? It's not the case. Optum is a subsidiary of United, and they handle a lot of things for them. They handle their technology side of things, but they also handle their provider relations. OptumRx provides their mail order pharmacy and things along that nature. So, but they founded Optum, and I thought that was a very good move for them because Optum was able to kind of, make sure that a lot of different aspects that could be, having issues was ironed out, and that completely was created to fix problems and put out fires with providers and prescriptions and just different kind of things, provider relations, customer relations, and all those things. So Optum has helped them, and then Optum also with the technology side of things has really, really gone a long way. But my focus with United has always been this. A lot of insurance companies, and I mean a lot of insurance companies, they get to a point where they're very, very successful. And they do very well in the marketplace. Not meaning the marketplace, but like the marketplace meaning, the marketplace where everything is ever sold. People buy things in the marketplace. Marketplace is the economy, okay? But a lot of insurance companies get to a point where they are incredibly successful. There's a lot of companies that I could list off, but I'd get in so much trouble if I did, so I'm not going to. That have just become really large companies, but they don't move forward. They get complacent, they get content, and they just keep doing the same thing with the same model year after year, and they're always going to be prevalent. They're always going to be good, but they're going to have their moments where they take steps back because they're not moving forward. And in some cases, the insurance company kind of falls into obscurity. United Healthcare is not that type of company. United Healthcare is the type of company that no matter how successful they are, they're always looking to how to be better. And that's been my observation working with them as an agent. I'll give an example. A few years ago, I had thought, this was actually many years ago, so bear with me. I thought that the weakness they had was on their customer service side. I thought that typically what United Healthcare is known for is depends on the type of product you're talking about, but they typically have large networks of hospitals and doctors, not in every place. Every state's different, every market's different, but in the markets I work in, that's kind of what they're known for. Their networks are enormous. They contract with a tremendous amount of doctors and hospitals, usually more than a lot of the competitors. So they've had that going for them for some time, but at that point, their customer service wasn't bad, but it was kind of looked at in the middle of the fray. They weren't the best customer service, they weren't the worst, it was just kind of average, but sometimes people had negative experiences with them. They really put a lot of focus in improving that and fixing those problems, whereas a lot of insurance companies that have that problem don't give a damn. They don't give a damn. And we all know an insurance company that comes to mind when I say that. They don't care. Now, the way an insurance company is run is from the top down, just like any other insurance company. So the leaders at United Healthcare have clearly made a focus in improving things that they're not good at, innovating, changing, always having the attitude and mindset that we can get better. And that has a lot to do with it, because now when I talk to my own clients and customers that are customers of United, I hear more good things than anything about their customer service and how they kind of go above and beyond. United has also always looked to expand what they're doing, and take things kind of into their own hands. In the last couple of years, they especially in their Medicare Advantage plans, they used Silver Sneakers for a lot of their plans, like a lot of people do. If you don't know what Silver Sneakers is a program that offers a free gym membership for a lot of the contracted gyms in the area. United said, or they use Silver Sneakers or Silver and Fed, but United said, we're good. We want our own program, and we don't want to partner with Silver Sneakers. We don't want to kind of be at their mercy. So they created something called Renew Active, which is basically their Silver Sneakers that they own. Now they have complete control, and it seems like a good program to me. It's got some benefits that the others don't. and it's a little different, but it's a United thing. United a couple years ago was looked at as they didn't have necessarily a very strong mail order pharmacy program. They created OptumRx. Now they have probably one of the best mail order pharmacy programs. They innovate, they change, they grow, they expand, and they always are looking for ways to improve things that they're not doing well. And it's been amazing to watch over the past 5 years or so even, because even though they're the largest insurance company, they typically improve things that they haven't done well as a whole. And you don't really see that from the insurance companies that sit at the top. Usually the insurance companies that sit at the top are complacent and they just kind of do the same thing year after year. They're just kind of here, there, and nowhere. They're happy. Why do they need to get any better? They've made it in their minds. They don't need to improve anything. This is what makes companies that innovate like that special companies, in my opinion. And folks, I think that, granted, like I've said a billion times now, United Health is not the best fit for everybody. They're not going to be a fit for everybody, yada, yada, yada. No insurance company is. It's all dependent on a person's needs and preferences and et cetera, et cetera. But that's what's helped them be so successful in my eyes, is because when there are things that drive you crazy, they don't last, and they seem to get better. They've also, started to create clinics in certain places, where they have doctors that work for them, and they've really ramped up their house calls, where they'll send people to the customers' houses to do, free blood pressure checks and physicals and things like that. I mean, they just really, really are always trying to improve their level of care. And not to mention, I don't think that their partnership with AARP necessarily hurts either. Some people hate it, and that's neither here or there for me. But I think, people look at the AARP brand, because AARP is a company, so it's the American Association of Retired Persons. Everybody knows who that is, I take it. But they're an organization that they'll partner with different insurance companies in different insurance industries, and United's the one they partner with in the Medicare industry. And when they partner with an insurance company, they exclusively partner with that company. They won't partner with another company. They won't partner with like Humana or Aetna or Mutual of Omaha or any of these other companies. It's just United that they partner with. And so people see that brand, and it's recognizable. It's very recognizable for people, and I don't think that necessarily hurts over the long haul. I do think there's a lot of people that don't purchase their plans because of the AARP brand, because they hate AARP. So I think that's kind of a double-edged sword there, but it helps them be recognizable, because a lot of people recognize their plans as the AARP plan instead of the United Healthcare plan. Even though AARP is just a sponsor, they have nothing to do with providing the coverage. But it's fascinating to see. We'll have to see where the insurance industry goes, but becoming the largest insurance company by revenue in the world deserves to be talked about. It needs to be discussed. What are they doing right? Because clearly they're doing something right. And in my opinion, it's been their innovation. Constant innovation, constant change, constant growth, constant never being satisfied with the way they have things set up. And I think that plays a big part in the people at the top that a lot of the other insurance companies just don't necessarily have. Some of them do, some of them don't. But they do it in such a way that they're always improving. Even though they're a monster, they want to get better. And there's something to be said about that. Folks, thank you so much for tuning in. Thank you so much for listening to this episode. I know it's kind of short. I'm going to be bringing you another interview on Saturday. Now, I was supposed to do an interview with Tina Davis last week. She's had to reschedule a couple of times, and things have come up. We're scheduled to do it this Thursday, and it should go up and become public on Saturday. So hopefully we're able to kind of connect and get that interview done. So watch for that. If you don't know who Tina Davis works for Blue Cross Blue Shield, Regents Blue Cross Blue Shield of Utah, although they work in multiple states. And Tina kind of oversees her and another small team of people, they oversee the sales of Medicare products in Utah and some other states. So I think, and Tina's got a lot of experience. Tina's a very lively person, very smart, very knowledgeable about the Medicare industry, and I think it's going to be a really, really, really good conversation. Thank you so much for listening, folks. As always, if you're on Medicare or about to be on Medicare and you're either not sure on what you want to do when you sign up for Medicare, or let's say you're already on Medicare and you're just not sure if what you have is the best thing for you, I can help you. My organization can help you. Give us a call today for a no-obligation free consultation if you happen to live in Utah, Idaho, and Florida. Those are the 3 states that my company and myself are licensed to work with people in. We're always expanding that, and that's going to come to more states very, very soon. But for now, those are the 3 areas in the 3 states we work with people in. Call my office at 801-255-5340, 801-255-5340, and let's talk. Let's talk. No cost for a consultation, no obligation by any means. But if at the very least, folks, if you're not sure if you're happy with what you have, the only way to know for sure is to have it compared. And the worst case scenario that can happen is, turns out you're on the best thing for you and you can sleep better at night. And there's no price to that. If you don't live in one of those 3 states and you still would kind of like some of my knowledge and expertise, I wrote a book for people just like you that can help you. It's called Medicare Guidance, Picking the Plan for You. It's a beautiful red book with a Medicare card in the front. So head over to Amazon, type in Christian Brindle, Brindle, or you can type in Medicare Guidance. Either way, you should be able to find it. Right now, the book is going for $5.50. For that price, I'm practically giving it away. With shipping and handling and everything like that, it's probably going to cost you $10. For $10, you can get educated to make a decision that could potentially save you hundreds, thousands, maybe even tens of thousands, maybe even hundreds of thousands of dollars, depending on your situation, on making sure things are covered that need to be covered for you, premiums, not paying too much for premiums, the whole 9 yards, folks. It's worth it. It's an investment in your own knowledge of making a good decision, and you can't make a good decision unless you're empowered. Thank you so much for listening, folks. If you are listening to us on a platform that allows you to leave us a review, please give us a 5-star review. It helps us reach more people just like you and get this message out of Medicare empowerment. Thank you so much for listening, and I'm hoping to bring you this interview episode on Saturday. Happy Monday. Have a great week. I love you. Take care.